Well, good morning. Here we are in Guatemala City at International Focus on Healing's third molar extraction course. Tell me who you are and where you came from.
My name is Saurabh Srivastava, and I'm from Calgary, Canada.
Up in Canada, so you're old Canadian bacon guy, huh? Yeah, that's sort of. We met back in 2016 in Panajachel at the extraction course. And what have you been doing since 2016?
I've been very busy with my practice since then, and the practice is a very bread and butter type of practice. I'm doing a lot of extractions there. So after that course, I felt more confident, continuing to do lots of extractions, and then I wanted to do more wisdom teeth extractions.
So have you taken any other courses that could help you with that?
Yeah, so since that 2016, that's about 8 years ago now, I've taken multiple courses from different areas, and even including some relatives of mine that are dentists, and I've worked under their sort of tutelage as well.
Yeah. So how do you rate the course? I mean, this one compared to those, have you gotten things from them or gotten more from this or what?
You know, everywhere you go, you're going to pick up at least one or two things, and if you keep your mind open to different techniques, you will always be shown different ways of doing things. What I found in this course is I added many extra techniques that I was not aware of at all. In my 25 years of working, I still learned new things I did not know before, and that's always a good feeling when you can walk away from the course saying, hey, I didn't expect to learn these extra things, and it just adds quivers to your quiver box. So that's all it's all.
Put a few arrows in the quiver, right?
Arrows in the quiver.
Yeah, there you go. But anyway, so we started off with a course with a little didactic portion. Was that helpful?
Yes, absolutely. So the course that we came to here, 2 hours on the first day to establish a really good didactic baseline on some of the ways Dr. Fletcher teaches wisdom teeth extractions. Very valuable, and it is something that you can look forward to. You're not going to fall asleep in an 8-hour lecture here. It's 2 hours right to the point, full of great tidbits, and really gets everyone in the class up to a baseline without being to sleep.
So basically, you came here with some pretty decent skills. You've been practicing. We met in 2016, and you've taken some of those skills that you learned. You went back and honed them a little bit, and continued on, and took a couple of other courses, and then you came back. You came back here. Are you taking out every wisdom tooth that you see come in the door?
I look at wisdom teeth every day, like most general dentists do, but I would say I did maybe 5% of them. If they're erupted third molars, I'm doing most of them, 80-90% of them. But then if it was even covered, if the tooth was covered somewhat with soft tissue, I would just walk away, would not do them. So this is the reason I came to this course.
Okay. So those cases that you walked away from, do you think you're gonna take them on now, or?
Yeah. What's the beauty about a course like this is that you are presented with a theoretical background on how to assess the difficulty of removing the wisdom tooth for yourself and for the patient, what they're going to go through, and you have now a much better algorithm to decide what's a good case to do. And of course I'm not going to do every single wisdom tooth case that come in. I'm not an oral surgeon, but I feel I can offer my patients a much wider set of services in the clinic that they're already comfortable with. They're already comfortable with me, and I feel I can do more for them. And definitely put some numbers on it, I think if every 3 wisdom teeth come to me that are sort of soft tissue impacted, I think I can do at least one of them. So 1 out of 3 is much more comfortable now. For me.
Fantastic. So, I mean, did we jump right into taking out full bony impactions, or how was the process here?
That's a good point. I don't think jumping into full bony impactions is a good way to start your introduction to wisdom teeth removal. It's good to start with some things that you already know, like even an erupted molar, or upper maxillary molars that are erupted are a good place to start. Lower erupted molars. You get used to the assistant, you get used to the equipment, you get used to the forceps and all these things you've seen before, but you just need a couple of cases to get warmed up. And once you do that, then you're ready to tackle some of the more cases that you probably came here for.
So, what about the cases that you saw? Were the patients just standing around and you went and grabbed one, or how did you find patients?
The cases are very organized in this course. You get a chance to see the panoramic radiograph, even a CBCT, before you even see the patient. And there is usually a good discussion with the instructor on how to go about, taking that wisdom tooth out, especially if it's something you haven't done before. So that really helps. So when the patient is seated, you're not having to figure everything out right at the moment. You already have an idea of what's going on, and you already have a game plan.
So, some courses will spend a day or two on didactics, or actually send you stuff online that you would read. And, we did a 2-hour didactic session, and then we jumped right into taking out teeth, right?
That's perfect. Yeah. Nothing against courses that have a full day of didactic or a heavy portion of didactic, but what you need to know to keep learning the wisdom teeth, I mean, you can learn a lot in those 2 hours that are presented, and it's necessary, and it's also a good springboard.
Yeah.
And you're here to pull wisdom teeth and hands-on experience, so I think 2 hours is good.
Okay, and so we went from relatively straightforward third molars to more and more and more involved cases. By the time you reached the 3rd day, were you ready for 6 or 7 more days of wisdom teeth?
Well, it made me think what oral surgeons do. Don't their hands get sore after that? But 3 days is your Goldilocks zone. 2 days might not be enough, but after 3 full days of doing wisdom teeth and getting progressively more involved, you are after the 3rd day, I think you're good. If you can get a 4th day, you want to come for another 3 days, I think that's great. You're only going to learn even more.
Yeah, a lot of people will always ask, well, how many? And do you think that it's about the numbers, or?
Absolutely not. This is a course where quantity matters less and quality matters more. And quality here for me was defined by picking the right case and applying the techniques and the skills that Dr. Fletcher shows you in this course in a systematic way and so you can actually, put some muscle memory behind the theory that was put into learning how to pull a wisdom tooth that you never would have thought of pulling before. Mm-hmm. So if you can get 1 or 2 cases like that, take a little extra time and do that, then you have the knowledge in your mind to go ahead and tackle them at home. I mean, if you just try to do 10, lots of multiple cases, without actually slowing down and learning from each case, then you aren't really getting the benefit. At least I wasn't getting the benefit, but I got a lot of benefit here from doing it in that systematic way, waiting for the right case for me. Not too hard, not too easy.
Right. No. So we also talked about different cases that is probably not a good case for general dentists to do. And were you ever compelled to, well, yes, you're going to take on this case, or, you know?
I think I learned more about what goes into deciding whether a case is too difficult for me or for the patient. Sometimes, we can tackle a case, but it's not really good for the patient. So I learned better about my boundaries, but I think the real benefit of this course is my boundaries expanded. I didn't lose confidence in doing the cases that I had planned to do when I get back home. But there will always be lots of cases I will still refer to the oral surgeon. I'm not an oral surgeon, but I am, my boundaries were expanded. I think that's the best way to put it. Yeah.
Fantastic. So, what about bang for the buck? You paid to come here. You flew down. What was included in the cost of the course?
Yeah. So I'm one of those that did a lot of research on other third molar courses, and this is absolutely the best bang for the buck. The other courses are at least 4,000 plus per day of hands-on. This was way less than that. Plus, you get your hotel here free, and I found the hotel here to be very good. I would say at least 4.5 stars. Nice pool, great buffet in the morning, and you're only, I think, 10 minutes away from the clinic that you're going to be working at, which is also a great plus. The city itself, at least where we are in the city here, very safe, very modern. So it's overall, it's a very comfortable experience here, and an absolute plus for someone like me.
So, what about the clinic? Is it a rundown?
No, the clinic is wonderful. It is fully modern. Everything works great. There's lots of rooms for multiple patients coming in. The staff at the clinic is very organized, keeping the clinic running smoothly, bringing patients in. There is nothing, you're not shortchanged at all in the clinic at all. It is completely modern, clean, efficient, and that never crossed my mind as I was working in the clinic.
Fantastic. So basically everything's looking good. You're happy?
Yes, very happy. It's a good question. I'm 25, 30 years into being a dentist now, and and you're always looking for courses to expand your skill set. What this course did for me was give me some really good new techniques, put some hands-on on using those new techniques, and that's how I learned as a dentist. I think a lot of dentists learn like that. You have a great mentor here to guide you through your journey of expanding your skill set, and this is why I'm happy. Yeah, I can walk away knowing that I got to do the cases that I had in mind here. I learned, to just blank out. You can edit that out, but just catch my thought for a second. Yeah, I got a lot of experience doing cases that I wanted to do here. I actually at one point had to say, please stop. I need to go back a little bit. I need to stay in my comfort zone, and that was good. That was really good. So I actually would say there were more cases there for me to do, but I chose not to do them.
Okay.
I wanted to recolor the lines where I feel better about what I'm doing in the comfort zone that I'm in.
So basically, you were leaving the horizontal impactions alone.
Yeah, well, I know some of you are going to want to do horizontals, but I am happy just leaving that for the next course.
Yeah, great. Great. Now, you know, we talked a little bit about some of the other courses here offered at Quetzal Dental, International Focus on Healing, the implant curriculum, which is a comprehensive course, both prosthetics as well as placing the implants. And of course, our molar endodontic course that we had a couple of weeks ago. Both of those courses are taught by board certified periodontists for the implants and endodontists for the molar endo. I mean, quality like you've experienced for those courses, those instructors are amazing. And so hope to see you again.
Yep.
Anyway, be safe up there in the frozen tundra. Yeah, and up in Calgary. And so we'll let you go. Thanks for taking the time, and hope to see you again, bud.
Thank you.
All right, bye-bye.